Bismillahirrahmanirrahim. The physiology of male sexual act is described in this video. The neuronal stimulus for the performance of male sexual act starts from the primary sensory organ, that is the glans penis, and this is a highly sensitive organ, and it detects sexual sensation that are started by stimulation and slippery massage of the area. Then these signals are transmitted through pudendal nerve, and then they reach to sacral plexus, and finally the sacral spinal cord is activated, that send these signals to the undefined areas of the brain, that results in the activation or stimulation of the stimulation for the performance of male sexual act. Then there are some adjacent area stimulation that results in the activation or directly of the sacral portion of the spinal cord, and these areas are anal epithelium, scrotum, and perianal areas. Uh, then the filling of the sexual organ with secretion uh, or internal structures secretion, they are also responsible for the activation. These organs are urethra, bladder, prostate, seminal vesicle, testes, and vas deferens. Filling of these organs with secretion is responsible for the stimulation of for the performance of the male sexual act. Similarly, mild irritation due to mild infection and inflammation of the genital tract is also responsible for the start of sexual drive. Then aphrodisiac drugs such as cantharidin, they stimulate by irritating bladder, urethral mucosa, and induce inflammation and vascular congestion, that results in stimulation for the performance of male sexual act. Then there are some psychic element for the stimulation of male sexual act, and these are the mental and emotional triggers such as sexual thoughts or imagination or dreams that involve the sexual activity may initiate full male sexual act, including ejaculation. Wet dreams or nocturnal emissions occur during sleep, and they are also driven by sexual dreams and are common in teenage years, and it is a normal part of pubertal development and sexual maturity. So, mental stimulation alone, without any physical contact, can trigger the physiological pathway for male sexual response. So the male sexual act is primarily a spinal reflex. Though brain input enhances or suppresses it, it is not essential for execution. The reflex control centers are located in the lumbar and sacral region of the spinal cord, and the integrates signals, these areas, they integrate signals from psychic input from the brain or genital stimulation or physical stimulation. So ejaculation can still occur if even if the spinal cord is severe above the lumbar region, and it is proven by animal studies and rare human cases. So the source of to summarize, the source of the trigger mechanism is brain by sexual thoughts and emotion, and genital stimulation, that is the glans penis or the perineal structures. So the male sexual reflex is hardwired to the spinal cord, making it autonomously functional even without brain control, though psychic stimulation usually enhances this experience. So stage 1 is the penile erection that has got the role of parasympathetic nerves. This penile erection is initiated by sexual stimulation that can be psychic, thought, dream, visual, or auditory cues, or they can be physical, that may be touch or friction, especially on the glans penis. Then, the parasympathetic nerves from the sacral spinal cord release nitric oxide and acetylcholine, and there is effect on vasodilation of the penile arteries through relaxation of the smooth muscle in the corpora cavernosa and corpora and the corpus spongiosum that result in increased blood flow into the erectile tissue. Also, there is venous compression because the corpora fills with the blood. Veins are compressed and reduce the blood outflow and maintain the rigid erection. So this is attained by alpha receptors that result in penile erection. So this penile erection is a vascular phenomenon that is controlled by parasympathetic signals initiated by sexual arousal. It prepares the penis for penetration during the intercourse. So this stage 1 can be further described as the neural pathway or sacral portion of the spinal cord through the parasympathetic impulses. It involves the pelvic nerves and then act on the penis. These parasympathetic fibers that travel via pelvic nerve, they secrete some neurotransmitter. The acetylcholine, nitric oxide, and vasoactive intestinal peptide (VIP) are secreted, and the nitrous oxide stimulates guanylyl cyclase that increases cyclic GMP, and this cyclic GMP relaxes arterial wall and trabecular smooth muscles in corpora cavernosa and corpus spongiosum and allow rapid arterial flow of the blood. Then there is increased blood flow to this area, and due to this increased blood flow, this vascular cavities they fill rapidly. The venous outflow, as I have described earlier, it is compressed that reduce the drainage and that result in engorgement, rigidity, and elongation of the penis. So corpora cavernosa have strong, tough, fibrous coats. This allow high pressure buildup and ballooning of the erectile tissue that results in full erection. So penile erection is a neurovascular event that is initiated by parasympathetic nerve impulses and sustained by nitric oxide and cyclic GMP, and physically supported by vascular sinusoid and fibrous covering of the corpora. Important to add that due to relaxation of these penile arteries, the relaxation also releases local endothelial nitric oxide, and this also adds to the blood flow, increased blood flow uh, that result due to dilatation of the arteries and vessels over there. Then there is lubrication. Lubrication is also a parasympathetic function. So alongside erection, the parasympathetic the stimulation or impulses, they stimulate urethral glands and uh, the bulbourethral glands or Cowper's gland that secrete mucus which travel through the urethra and provide initial lubrication during coitus. So, majority of lubrication during intercourse comes from the female sexual secretion, not the male. So, if this lubrication is inadequate, it can cause painful grating sensation or inhibited sexual response that will result in potential failure of the sexual act. And finally, we can summarize that this lubrication during the male sexual act is a parasympathetic driven function, aiding comfort and effectiveness, but is supplemented predominantly by the female secretion during intercourse. Then there is emission and ejaculation that are the function of sympathetic nerve. So this occurs at the peak of sexual stimulation, and reflex center is present in the spinal cord that are activated. They are present in the T12 to L2, and they stimulated via hypogastric and pelvic sympathetic plexus, and then they effect on genital organ. The emission, the pre-emission is the another step. The pre-ejaculation state, the vas deferens and ampulla contract and push sperm into the internal urethra. Prostate gland and seminal vesicle also contract and expel seminal and prostatic fluid, and the fluid mix with the mucus from the bulbourethral glands and urethral glands, and then they uh, form semen in the internal urethra. This full process is called emission, and emission and ejaculation are the climactic sympathetic driven stages of the male sexual act, and sympathetic impulses cause sequential contraction of reproductive glands, culminating in the release of semen into the urethra. So, filling of the internal urethra by this semen, it triggers sensory signals via pudendal nerve, and there is transmission to the sacral region of the cord, and there is feeling of fullness in the genital organ, and further stimulate rhythmical contraction of prostate gland, uh, seminal vesicle and vas deferens, and ischiocavernosus and bulbocavernosus muscle are responsible for these contractions that compress base of the penile erectile tissue and then increase pressure in the penile erectile tissue and genital duct and within the urethra. So the semen is forcefully expelled through the urethra to the exterior. This process is known as ejaculation. So ejaculation is a spinal reflex activated by urethral distension, resulting in coordinated muscle contraction that create pressure wave expelling semen. Then there is pelvic and body muscle rhythmic contraction that extend beyond genital organ. The pelvic muscle, trunk muscle, they rhythmically contract, and they facilitate the thrusting movement of the pelvis and penis and propel semen deep into the vagina, and possibly reaches the cervix of the uterus. The orgasm is defined as the entire experience of emission, ejaculation that is associated with physical sensations, and it is accompanied by high sensory arousal, powerful muscle contraction, and pleasurable climax. The final stage is the resolution that follows orgasm, and there is uh, sexual excitement that was present during the orgasm. It rapidly dissipates within 1 to 2 minutes and erection subsides and body enters a refractive phase. So orgasm is a peak of sexual function involving coordinated muscular contraction for ejaculation and thrust, and resolution follows swiftly, marked by the cessation of arousal and the return to a resting state. Thank you for watching this video. If you have any query, please write in the comment box.